I'd like to thank everyone for joining us this afternoon to hear about what's a really important issue and one that I'm very passionate about as well. So as Billy said, I co-chair ICAAP's advisory committee on sugar-sweetened beverages. In addition to that, was involved in as the co-chair of ICAAP's MOC project on childhood obesity, and I'm also chair of the American Heart Association's obesity committee nationally. And AHA, as many of you know, is very, very active in the issue of sugar-sweetened beverages. So I'd like to start by going over the objectives. There's a couple of things I'd like to point out about the objectives. So we're going to talk a little bit about the adverse effects of regular consumption of sugar-sweetened beverages. But on purpose, that aspect of the issue is going to be de-emphasized significantly. So we're not going to talk about it, largely because most of those issues have been resolved and there's pretty conclusive evidence. But really we're here to talk about the HEAL Act, the Healthy Eating and Active Living Act, and how, as a physician, you can get involved in supporting it. So the other thing I'd like you to think about is 3 reasons why sugar-sweetened beverages are a suitable target for obesity prevention, and there are 3 of many. We could talk about those in detail. And be able to provide short and accurate responses to common questions raised by healthcare professionals and others, including patients, about moving towards healthier beverage consumption. So at our last meeting, we kind of brainstormed about some of the common questions that both doctors and patients have about this issue. And then we'll talk about simple ways to assess beverage consumption and talk a little bit about taxation and its potential impact. And then Mary, I'm going to turn things over to Mary, who's going to talk about the Healthy Eating and Active Living Act, its current status, its provisions, and specific messages that you can provide to others about the HEAL Act. So before we venture into some of the nuts and bolts of the talk, I think we on the same page as far as definitions go. Sugar-sweetened beverages is a very, very broad category. There are at least 9 different types of products that are in there. I could always forget what they are, but they're regular soda, fruit drinks, fruit punches, sports drinks, sweetened coffee drinks, sweetened milk drinks, regular sweetened iced tea, energy drinks. The list goes on and on. But essentially, they are all drinks that are sweetened with sugar, high fructose corn syrup, or other caloric sweeteners. And these are drinks with added sugar in them. So just to make sure we're talking about the same category of beverages for everyone. We are not talking, therefore, about 100% fruit juice, for example, or diet drinks. So I mentioned at the outset that we don't want to spend a lot of time on the health consequences and the relationship of sugar-sweetened beverages to obesity. In fact, Frank Hu, who is probably one of the leading researchers in the world on this issue, recently published a paper that began with the title, "Resolved. There is sufficient scientific evidence that decreasing sugar-sweetened beverage consumption will reduce the prevalence of obesity and obesity-related diseases." And essentially, what Dr. Hu does is synthesizes all the evidence over the last 10 to 15 years about this issue and makes an extremely convincing argument that continuing to debate this issue, which some people do, especially those who receive support from the beverage industry, is no longer useful. Just as in the year 2015 almost, we would not debate whether or not cigarette smoking was linked to lung cancer. We probably ought to stop having this debate as well. There is so much evidence from so many different forms that meet so many different criteria for causality, which we'll talk about in a moment, that the issue of health, the health impact of sugar-sweetened beverages is largely resolved. So here's just a sample of the evidence from the paper, and of course there's many different types of evidence that are presented. It's a wonderful paper if you have a chance to read it, and the reference is available for you. But this is a study that actually was a randomized trial in which some children were given sugar-free flavored drinks and others were given drinks with sugar included and followed up for a period of roughly 18 months in terms of their BMI Z-score. This was done in Europe, and it would be very difficult to do a study like this, as you can imagine here. And so you can see that the BMI Z-score increased quite significantly among the children who consume the sugar drinks. This is like one serving a day. It also increased slightly among those who are in the sugar-free group, but there's quite a big gap between the two groups. In slide B, part B on the bottom of the page, you'll see the size of that gap kind of widening over time, at least up to 12 to 18 months. So this is probably one of the best studies that we have because it's randomized, because there is a suitable control in terms of the sugar-free drink, and there's a pretty lengthy follow-up period of 1.5 years that documents the actual impact upon weight of sugar-sweetened beverages. So the next thing that I want to go over as kind of a summary of the evidence around sugar-sweetened beverages and obesity, and not just obesity, but obesity-related diseases. These are the Bradford Hill criteria. If you've ever studied epidemiology, Bradford Hill was an epidemiologist in England who established certain criteria for causality. So, for example, is smoking related to lung cancer? Is water pollution related to chronic diarrhea in children, etc.? And according to Dr. Who, this issue of sugar-sweetened beverages meet all of these criteria by a long shot. So first of all, there is the criterion of strength. So we know that prospective cohort studies have consistently shown a positive association between sugar-sweetened beverage intake and long-term weight gain and obesity in both children and adults. And we've also had randomized control trials that have shown the significant benefits of reducing sugar-sweetened beverages on body weight. So body weight does come down. So that's a pretty strong level of evidence. Furthermore, the evidence is consistent. It's consistent in prospective cohort studies as well as randomized trial. Temporality is also illogical with respect to this issue. You start drinking sugar-sweetened beverages, your weight goes up. It's not the other way around. It's not that heavy people tend to drink more, for example, which is an argument that's also made. There's a dose-response relationship. As you drink more of these beverages, the amount of weight gain increases in a dose-response manner. There's also the issue of biological plausibility. We know that sugar-sweetened beverages are very, very concentrated in terms of their energy. They have very rapidly absorbable sugars. If you do consume these beverages in liquid form, it's likely that the gut hormone axis and the neurological signaling that needs to take place between one's stomach, for example, or the GI tract in general, and the brain does not have a chance to kick in, and therefore there isn't a lot of satiety, and people don't compensate by eating less afterwards. We'll talk about how to explain that to the general public in a second. Alternate explanations. There's a lot of all of these studies that the most credible ones have looked carefully at potential confounders, and these have been adjusted for statistically, and they continue to find this strong link between sugar-sweetened beverages and obesity. And finally, as we said, there's actual experimental evidence. This is not just prospective cohort evidence or randomized control trials that show reduction in weight, but we actually have quite a number of studies now that show that reduction of sugar-sweetened beverages decreases weight gain and adiposity in children, which of course is the target audience for this webinar. So in addition to weight gain, obesity, cardiovascular risks, which are probably the most well-known negative health impacts of sugar-sweetened beverages, we have others that are less well-known. One is dental caries. So Spooner has found, for example, going back many years, now almost 20 years, that for every 5-gram increase per day in dietary sugar, this increases the risk of dental caries by 1%. Dental caries are an extremely important issue. They are closely related to poverty. There are significant disparities between children of different racial and ethnic groups. If you look at this slide on the right, this gives you the national prevalence levels of dental caries. So among young children, just ages 3 to 5, only about 11.3% of non-Hispanic white children have cavities, much higher among black and Hispanic children, much higher among those who are below 100% of the poverty level. That disparity persists in all age groups, right into adolescence as well. So it's a shame, but not only does obesity disproportionately affect the poor, the other effects of sugar-sweetened beverages are also significant upon the poor because, of course, these beverages contain huge amounts of sugar per day. So even those who are not entirely convinced, that it's hard to believe that there are a few out there that sugar-sweetened beverages are related to obesity, they generally do accept that sugar-sweetened beverages are related to dental caries. Another neglected negative effect of sugar-sweetened beverages are the behavioral problems caused by consumption of large amounts of caffeine. So caffeinated beverages constitute the majority of sugar-sweetened beverages. beverages, whether they're clear like Mountain Dew or colas. A 16-ounce caffeinated soda contains about 50 to 75 milligrams of caffeine, roughly the same as a cup of coffee. But you have being marketed now the energy drinks that go up, believe it or not, to 300 milligrams per serving. The picture here on the right is of the Hyper Shot, which is currently the most caffeinated beverage available on the market, and it's become popular, I think, especially with adolescents who try to stay awake. This, of course, leads to insomnia, palpitations, and other problems, as you might imagine. And incidentally, this Hyper Shot, I think, sells for almost $5 for the little bottle there, so not a cheap drink either. So there are multiple effects of excess caffeine, including poor sleep. There's anxiety, addiction, increases in blood pressure, reduced control of fine motor movements. You can imagine that this causes tremor, stimulation of urination. There are, of course, positive effects as well, but certainly there's no need to consume the amounts that are currently available in some of these beverages. So in addition to that, bone density is a concern, especially among girls. So you have high sugar-sweetened beverage intake, which in some prospective studies has been shown to be linked to low calcium intake. So you can imagine the typical adolescent girl who is drinking quite a few of these sugar-sweetened beverages per day and is not consuming as much milk or other products. And this leads to lower bone mass accrual at a critical period in adolescence and greater risk of fractures and overall poor bone health as she becomes a young woman. So an extremely critical issue. And this, of course, is true not just for sugar-sweetened beverages, but for diet beverages as well. In fact, that's probably the type of beverage in which this phenomenon has been better documented, that some adolescent girls consume so many diet drinks that their calcium intake is significantly lower. And, of course, there is some evidence that sugar-sweetened beverages and diet beverages do have an adverse impact on bone turnover and bone mass accrual, independently of whatever else the child is consuming. So those are some of the health impacts. As I said, it's going to be a very, very brief introduction to them. One question that often comes up is, why are you picking on sugar-sweetened beverages? Why not, other categories of junk food? Well, there are many compelling reasons. So first of all, there's strong evidence linking their consumption to obesity and other problems. Strong evidence that reducing sugar-sweetened beverages helps children and families achieve or maintain a healthy weight. The second important reason is that SSB consumption is a relatively simple behavior. It's a single behavior. If I tell someone to stop drinking sugar-sweetened beverages, they're probably going to get a pretty good idea of how to carry that out. You can easily set goals, which we'll do, and you can easily carry out counseling with respect to the issue. Let's also keep in mind that sugar-sweetened beverages represent the largest source of added sugar in children's diets. It's probably more than half of the added sugar in children's diets. So there's that whole prevalence issue as well, because drinking it is so common. And the third reason is changes in public policy. Of course, the HELAC does include taxation of sugar-sweetened beverages. Appear to work. Most of you are familiar that the city of Berkeley recently passed a law mandating a 1 cent per fluid ounce tax on sugar-sweetened beverages. These efforts have been going for several years now. That was the first successful one. We're hoping, again, for Illinois to be a state that will be successful. There are a few other states that are moving in that direction, including Vermont and Hawaii. That having been said, there are two reasons to think that taxation will work. First of all, there's been a lot of modeling that's been done by Lisa Powell and others here in Chicago. She's at the University of Illinois. That shows that relatively modest taxes can have an impact upon consumption, and therefore, if you model things out, they can have an impact on body weight. But the more conclusive evidence actually comes from Mexico. Mexico instituted a sugar-sweetened beverage tax in early 2014. And consumption of sugar-sweetened beverages has dropped about 10% over the course of the year. And now it's starting to creep up again as people kind of adjust in terms of cost and price. But there is significant evidence, therefore, that public policy, including taxation, can work. Now, by contrast, people will say, why not pick on potato chips? What's next? Ice cream, etc. Well, perhaps if the average child ate ice cream all day long, which of course is not easy to do because it's very cold, we might have selected ice cream, or perhaps ice cream or other forms of junk food would have been subject to the kinds of policy changes we're proposing in the HEAL Act. But the fact is, children drink excessive amounts of sugar-sweetened beverages. The average adolescent boy in America drinks almost 28 ounces per day. That's why they're the #1 source of sugar. They're found widely across the United States. Sugar-sweetened beverages are disproportionately consumed by the poor and minorities. So there's many reasons why this particular category of unhealthy food or beverage is being targeted. So that having been said, what might you encounter as a physician or as a physician advocate in response to your support for proposed taxation? And we'll talk about the details of the HEAL Act. And of course, there are many tactics that you'll find. These are just some of the things I've encountered in speaking out about this particular issue, whether it's been testifying here in Chicago or around the country. One is simply distraction. So in many cases, people will say, well, you know, it's true perhaps that sugar-sweetened beverages might be a problem. I'm not sure. But what we really should be talking about is getting people moving, promoting physical activity. And that's true. Americans need to be more physically active, but we're not talking about that. We're talking about sugar-sweetened beverages. So I just want you to be aware of that particular tactic, kind of changing the issue and diverting and saying, well, this is not a problem. The real problem is this, and then somebody expounding about the benefits of physical activity. It's a very, very common tactic by industry. Personal free, it's kind of like going back 40 or 50 years when cigarette smoke was beginning to raise concerns in the public health community. People would say, oh, we really need to talk about air pollution or healthier living in general, not cigarette smoking. The other issue that comes up is personal freedom. People should have the freedom to drink what they choose without government interference. And of course, they ought to, and they will remain free to do so, even if the HEAL Act passes. The price they pay, of course, should more closely reflect the health impact, including the costs of their choices. So, I mean, it's very analogous to cigarette smoking. Yeah, you have the right to smoke if you wish, but smokers do accumulate healthcare costs, and they do affect other smokers, and therefore they ought to pay a price for that. I don't think that's anything that's unusual. And then, of course, there is the old legacy of pouring rights contracts. Many of you know that sugar-sweetened beverages have gradually been removed from schools, beginning in around 2006 with the Healthy Alliance for the Healthier Generation. But prior to that, individual schools would sign pouring rights contracts with specific beverage manufacturers. So you either signed with Pepsi or Coke, which means your school, if it was a Coke school, could not serve Pepsi. So these beverage industry often cites, well, you ought to be able to drink whatever you want. Well, it's fine, but when it's convenient for them, they went about restricting choices of children. So if my child is in a Pepsi school, she cannot drink Coca-Cola. And that, of course, is inconsistent with their support for personal freedom. So I would point out that hypocrisy if you ever have a chance to do so in response to that argument. So additional tactics, of course, you can anticipate, they will often cite unrealistic expectations of evidence. You can't prove 100% that sugar-sweetened beverages promote obesity and obesity-related disease, despite the article by Dr. Who, which summarizes so many different levels of evidence. That's true. This is a tactic used by tobacco companies. The preponderance of evidence supports the role for sugar-sweetened beverages in obesity and obesity-related disease. You can't prove 100% that cigarette smoking is related to lung cancer. You can't prove that Santa Claus doesn't exist. It goes on. But how many people doubt the link between cigarette smoking and lung cancer these days? So it's not really a viable argument. I think it's a matter of convincing people through different levels of evidence that this phenomenon is real and is serious and is harmful. So the next argument I wanted to go over was a calorie is a calorie, no matter in the form of soda or vegetables. This is absolutely true, but satiety is the key concept. If you're hungry and eat a solid meal, you won't be that hungry anymore. If you drank the same number of calories in the form of sugar-sweetened beverages, you would likely still be hungry and eat something, leading to increased intake. And that's probably a relatively simple way to explain the link between liquid calorie consumption, the lack of satiety, and subsequent weight gain. So that having been said, those are some of the key issues. So we've covered the health impact of sugar-sweetened beverages. We've covered reasons why sugar-sweetened beverages are an ideal target for obesity prevention efforts. We've talked about responses to some of the industry tactics that you might encounter. And there are some other additional skills that I think that physicians should have with respect to this issue. One is, how do you assess sugar-sweetened beverage consumption? Well, there have not been a lot of great tools. I use some of them in research studies, but they are awkward. There's a questionnaire called the Bev 17, for example, Beverage 17, in which you have scales and serving sizes of many different categories of beverages. Certainly not something that's useful clinically or even useful in a community setting where you just want to get a good idea of what people are doing. So the question I recommend is quite simple. Do you drink anything besides water on a regular basis? Or what did you have to drink besides water yesterday? Let's assume it's early in the morning. Right now it's about 12:30 p.m. And ask somebody, well, what did you have to drink besides water yesterday? And hopefully they'll be able to recall their food and beverage intake the prior day. And of course, most children and adolescents will tell you about a variety of things they might have had. And you can probe them a little bit further. But a very simple question in order to assess sugar-sweetened beverage intake. And a very useful question because it does not require the child or adolescent or parent or an adult, an independent adult, for example, to figure out what a sugar-sweetened beverage is. You're not asking them, did you have a sugar-sweetened beverage yesterday? It does not require you to ask about the 9 or 10 different categories of sugar-sweetened beverages, because that's very difficult to do and time-consuming as well. And it actually gives you a pretty good overview of their overall beverage intake as well. So they may have had some water, but they may have had some pop, they may have had something else as well. And you can actually figure out what times and when this is taking place. Here's a quick assessment tool. There's lots of them like that. These are just some basic beverage categories and the approximate number of servings. Of course, you know, a serving is quite hard to figure out sometimes, especially with sugar-sweetened beverages. But roughly look at 8 to 12 ounces. And hopefully people will understand that. Some people understand the entire 16 or 20-ounce bottle to be one serving. And, of course, it's not. It's usually about 2. But here are some of the categories of sugar-sweetened beverages to keep in mind: the full-calorie soft drinks, fruit drinks, punches, energy drinks, sports drinks, sweetened flavored milks, sweetened coffee drinks. Fruit juices is not a sugar-sweetened beverage, but it certainly contributes a significant amount of calories, and sweetened iced tea. But just a quick tool that you can use in your own practice or for any other particular reason. So another question comes up is, how do you counsel children, families, patients, community members, family members about this particular issue? So here's a case scenario I've used a lot in teaching. So Dion, her boyfriend, and her 3 children live on the south side of Chicago. Dion works as a nurse's aide at a nearby nursing home. She acknowledges that she and her family consume large amounts of sugar-sweetened beverages. The entire family is obese. Not unusual circumstances. So you can begin your counseling by saying, I'm concerned about how much pop you and your family drink. Do you know about some of the dangers of drinking pop? And I would plunge right into them, mentioning overweight, obesity, risk for diabetes, high blood pressure, heart disease, risk for tooth decay. I always throw tooth decay in there because it's not something people think about readily. And so even if they're not terribly concerned about some of these metabolic effects, this may be something to stimulate their interest in making changes. So here are some questions that might come up in response to your opening that discussion about counseling. And some of these responses you can use in many different environments and in many different contexts. So what should my family and I be drinking? So the best thing at that point is to present healthier beverage alternatives. Water and low-fat milk are probably the 2 best. Of course, you know, older children, probably it's water is the preferred beverage. The next question that often comes up is, do you mean bottled water? So we have this culture that the only quality water in our society comes in a plastic bottle. Many reasons why that's not true. Plastic bottles, as you know, are environmentally irresponsible in many respects. They fill up landfills. Bottled water can be very expensive sometimes. You know, I know in downtown Chicago you might pay $3, for example, for a bottle of water. So regular tap water is fine. Or if you do need to carry water, of course, you can get a refillable BPA-free metal container, of course, which are now being handed out in many schools across Illinois. So that's fine. My kids don't like the taste of water. It's a question that often comes up. or point that often comes up from families. First of all, we all know water does not have a taste, but it really isn't about the taste of what you consume. It's about creating a healthy beverage environment at home. So if you are thirsty and water is the beverage that's available to you at home, children, adults, of course, will drink water, and they will grow accustomed to it, just like they will with anything else. So it's creating that environment that should be the priority, not worrying so much about the taste of specific beverages. Another point that often comes up, especially from parents, is I'll keep the soda for myself and keep it away from the kids. As you can imagine, this doesn't work, first of all. And it's not consistent with creating a healthy beverage environment, which should be the priority. So when we talk to patients, community members, whoever it happens to be, you can provide some individual counseling, but typically you're going to speak to a parent if it's in a general pediatrics office about creating that healthy beverage environment in which everyone is a full participant and everyone takes responsibility so that none of these sugar-sweetened beverages are at home at all. And of course that's beneficial for everyone who lives there. So will we lose weight if we switch to water? If you drink a lot of sugar-sweetened beverages now, yes, you will lose weight. No question about that. And when I was clinical director of a pediatric obesity center for many years, the weight loss among especially adolescents who drank significant amounts of sugar-sweetened beverages, it was highly significant. I had one 15-year-old boy who drank two 2-liter bottles of Mountain Dew per day, believe it or not. And he didn't exercise and he ate fast food, but the only change he was willing to make was to cut down the amount of Mountain Dew to about 2 cans. He lost about 15 pounds in the first month and a half to 2 months or so. So huge amounts of weight loss is possible. Some people will raise the issue that you can't get water in some places. And I've talked to some people around the state about this issue because, first of all, I wasn't convinced that was actually true. All schools in the United States are by law required to provide drinking water that is freely accessible at all times during the school day. And unfortunately, implementing this particular requirement has been somewhat of a struggle in Illinois, as it is in other states, especially in poorer school districts. So they will have water fountains, but the water fountains are either not clean or they're not maintained well, and children naturally shy away from them. And this, I think, is actually the consequence of this huge movement towards sugar-sweetened beverages in the 70s, 80s, and 90s, where people abandoned drinking fountains essentially for beverages that they would purchase. When I was a kid going to school, of course, you drank from the fountain when you were thirsty. Water is available in most other environments. In the meantime, a filled reusable water bottle is useful. So filling that bottle at some point, even at home, and giving it to the child is a useful way to get around the water supply issue. And many schools in Illinois are now handing out water bottles to their patients. Okay. Another question that we raised in our advisory group was about diet sodas and other drinks. So there have been, and the message I think has to be consistent across the board. And so my message is the following whenever anyone asks me about diet drinks. And I will say that they are probably better than sugar-sweetened beverages, but certainly no substitute for water or low-fat milk. And then parents, children, families in general can make up their own mind based on that information. There, of course, has been recent concerns about the unhealthy impact of these products, the fact that they may stimulate appetite, that they may confuse the neurohormonal signaling mechanisms in our brain, and therefore actually lead to more intake and food, for example, later on. That some people try to compensate for excess eating by drinking sugar-sweetened sugar-free beverages, which is consistent with the fact that obese individuals are more likely to drink diet drinks than non-obese individuals. And of course, the concern about bone health among adolescent girls is significant among diet drinks. Generally speaking, there's nobody that would tell you that these are healthy alternatives. They are probably better, as I said, than the actual sugar-sweetened versions of the same products, but they're not substitutes for water or low-fat milk. Some of the other benefits of making smart beverage choices cost savings is a significant one. If your family drinks 1 to 2 2-liter bottles for a family of 4 per day, which is not unrealistic at all, that could be as much as $1,000 per year. Given that consumption of sugar-sweetened beverages is much more common in lower-income families, that we are still kind of emerging from the recession and that many people are struggling, $1,000 of additional discretionary income per year is a very, very, very significant amount. So I'd like to turn things over to Mary, who's going to talk about how we can support the HEAL Act, which has as its foundation much of the information that I presented to you, both the science-based information about the unhealthy effects of sugar-sweetened beverages, as well as some of the messages that you can give to your patients and their families. Mary?
Thank you, Dr. Rao. This is Mary Elsner, Director of Obesity Prevention Initiatives at the Illinois Chapter, American Academy of Pediatrics. I'm also the staff responsible for the Illinois Healthcare Provider Campaign on sugar-sweetened beverages. I'm going to be summarizing some of the major goals and provisions of the Healthy Eating and Active Living Act, or HEAL Act. As discussed earlier, the link between sugar-sweetened beverages, obesity, and its related conditions has been established. Obesity is complex. We know we must take a multi-pronged approach to reducing obesity rates. The Healthy Eating and Active Living Act is one of those approaches. The HEAL Act was introduced in the Illinois State Legislature in 2014. It's part of a larger multi-year campaign on sugar-sweetened beverages called the Rethink Your Drink campaign. It provides Illinois communities opportunities for healthy living. The Rethink Your Drink campaign engages Illinois communities and healthcare providers to promote healthier beverage options. The Healthcare Provider Campaign on Sugar-Sweetened Beverages is led by the Illinois chapter of the American Academy of Pediatrics in conjunction with the Illinois Alliance to Prevent Obesity, a coalition of more than 140 organizations in Illinois working to develop solutions to the obesity epidemic. Here are some of the reasons behind the HEAL Act. Our communities are suffering from largely preventable conditions. Sugar-sweetened beverages are the biggest source of added sugar in the American diet, and they contribute to high rates of obesity and related conditions, costing us $6 billion per year in unnecessary health care costs. If healthy options aren't available or affordable, it's hard for people to make healthy choices even if they want to, especially in underserved communities. There are ways of changing our environment and policies to support healthier choices by creating, for example, safe places for children and families to exercise and providing access to healthy and affordable foods. The Healthy Eating and Active Living Act would provide kids, families, and communities the tools to live healthier lives. And how does it do that? The HEAL Act establishes an Illinois Wellness Fund with revenues through a single penny per ounce tax on sugary beverages. The HEAL Act is expected to raise $600 million a year in state revenues to invest in prevention. The revenue from the HEAL Act would be used to reinforce the goal of making comprehensive changes to address the obesity epidemic. Approximately 50% of the revenues from the HEAL Act would go towards clinical services and community intervention programs in the Illinois Medicaid program, and approximately 50% would go into community prevention for efforts we know will work to reduce obesity. The bill calls for funding of patient access to weight management programs, multidisciplinary providers such as social workers, and care coordination. It would help fund evidence-based community physical activity and nutrition intervention programs such as the MEN program, Mind, Exercise, Nutrition, Do It, for children, and the Diabetes Prevention Program. The HEAL Act focuses on populations at the greatest risk of overweight and obesity. The other half of the funds would go to community prevention. For instance, healthier school lunches or PE programs, chronic disease prevention efforts through public health departments, physical activity improvements such as safe routes to school, nutrition education, and local food systems for farmers markets and community gardens. The Act prioritizes funds to go to communities with the greatest needs for these resources. Economists from the University of Illinois did some estimates and found that a proposal like this one could save $150 million a year in obesity-related healthcare costs. They estimated that there would be a 5% reduction in adult obesity and a 9% reduction in childhood obesity. And once you add in the effect of investing the money back into the community and prevention, the impact could be even larger. Plus, you would see a small increase in Illinois jobs. In order to raise the revenue to invest in wellness and prevention, the proposal would place a tax on Illinois distributors of sugar-sweetened beverages. The tax is structured as an excise tax, so that consumers would see a price difference on the shelf, and the tax would promote reduction in consumption. You see listed on the slide some of the drinks that are excluded from the tax. The specific definition of sugar-sweetened beverages is included in the state bill. As part of the multi-year campaign, the Healthy Eating and Active Living Act was first introduced in 2014 in the Illinois House and Senate and wasn't expected to pass out of the state legislature, but is now gaining momentum. The 2015 HEAL Act must be filed in February and has the support of the same lead sponsors. The 2015 bill includes revisions to strengthen the language of the bill and clarify its intent. Would the general public support the Healthy Eating and Active Living Act? From focus groups, we have learned that the public would support such a bill if it provides kids, families, and communities with the tools to live healthier lives. Language matters, and we have also learned that there is a preference for using specific language when discussing the bill. Healthy Eating and Active Living Act versus HEAL Act, sugary drinks are preferred over sugar-sweetened beverages, and the linkages to diabetes, cancer, and heart disease as opposed to the linkage to obesity. How can you get involved? Join the healthcare provider campaign on sugar-sweetened beverages. For more information, you can contact me, Mary Elsner, at the Illinois chapter of the American Academy of Pediatrics, and you can also download campaign resource materials from the ICAAP website. Thank you for joining us today.